About 30% of hearts among donors that are offered for transplantation are utilized currently. It's one of the lower figures in organ transplantation. One of the big reasons for that is there's a process that occurs when a donor becomes a donor where the heart can get injured. And then there's a period of time when the heart's taken out of the body and is no longer getting continuous blood flow. And both of those can be injurious to the heart. What we're doing here at Hopkins is we have been able to expand the number of donors that we can use with technology that we've created here to better preserve those donor hearts. I work with one of my colleagues here at Hopkins by the name of Mehrdad Qureshi. We do a lot of complex aortic work together. We have cases where the heart is stopped for 4, 5, 6 hours. And we noticed in those cases that the heart function seemed to come back very well with the cardioplegia or preservation strategy we used. And we thought about how we can translate that to transplantation. And so we took that cardioplegia strategy and we translated that with some modifications and we brought it to the lab. And now we have this protocol and solution that is portable, mobile, and we're able to take it anywhere in the United States or even beyond. The use of this technology has really revolutionized our heart transplant program here. The amount of time that patients are spending in the ICU is less than half of what it was last year. Our rates of dialysis are down more than threefold. And this is all while using more of those extended criteria hearts relative to what we did in previous years. And cardiac surgeons at Johns Hopkins, like Levi Watkins, have a history of using science and technology to make improvements and dramatically change patients' lives. Levi Watkins was an adult cardiac surgeon here at Johns Hopkins, and he performed the world's first human implantation of the ICD, or the implantable cardioverter-defibrillator. Prior to the ICD being available, patients would need to be in a monitored setting for an abnormal heart rhythm to be recognized. And then there was a big battery that was able to be connected to paddles to shock the patient. The ICD was a portable miniature version of that both recognized that abnormal heart rhythm and also performed the shock to be able to restart the heart. And that saved tens of millions, if not more, lives. And the ultimate goal of why we're here at an academic center, and particularly at a place like Johns Hopkins, is to be able to use science and use technology and be able to translate that to direct patient impact. And what Dr. Watkins was able to successfully do, and what I hope to do, is to make our field better for patients who are experiencing hardship on a day-to-day or longer basis.